So at InterSystems, we're really excited about the work that HBI are doing in partnership with Bumrungrad. We're really excited about that. And we're really excited about our actual partnership with HBI, with the predictive analytics. And I would encourage you to speak to either Eric or one of the InterSystems people here today if you'd like to get some more detailed information about this, about what we're doing and the predictive analytics, and if we can help you to embed predictive analytics into your systems. So thank you, Kenny, and thank you, HBI and Eric. Okay, so we're in one of the most dynamic growth regions in the world. And we're sharing here the same health problems, the same issues that other regions of the world are experiencing. Aging population, everybody is aware of aging population. Growth in chronic illness and chronic disease, ever increasing costs in healthcare, and the real complexity of medical care, the complexity of systems, the complexity of analysing disease and actual treatment. This is really what's driving healthcare providers, hospitals, healthcare facilities to go down the digital transformation road. We actually did a spot survey across all of Southeast Asia a little while ago, and the idea was to do a survey across clinicians, across the executives of healthcare facilities, and get some feedback from them of where they believe they are today in the digital transformation journey. So where are they today, and where do they expect to be in the next 5 years? And so I'm going to highlight just 4 of the top things that they talked about. So, paper records. I don't think there's any great surprise here. It highlighted the fact that about 56% of the healthcare organisations across the region are still using paper records. But where do they want to be in 5 years? They want to get down to 6% or less. Artificial intelligence, machine learning, we've just heard from Kenny and HBI. It's now becoming a reality. It's not just hype and what's been you read about in the press, you read about in the media. It's becoming real. Across the region, our spot survey indicated that at this stage there's only about 5% of the organisations that are actually doing something in this area. But look at the growth. Look at where healthcare organisations want to be over the next 5 years. 50% plus. 50% plus. And this is feedback that we're getting through our survey. It's feedback that's coming to us directly. So that sounds like good business for Eric and HBI. Big data analytics. At this stage, everybody's aware of the information that's being captured in their systems. It's now a case of bringing all that data together and being able to analyse that data and make really good use of it. At this stage, that's about 13, our survey indicated, about 13% of the healthcare facilities in this region are really doing something with analytics and big data. Where do they want to get to? This is probably one of the biggest scoring areas within 5 years. Nearly 70% of the facilities that we surveyed are saying they want to be analysing their data. What does that mean? They've got to bring their data together, they've got to capture it, and they've then got to be able to have the ability to actually analyse it. Mobile apps for patients. I think we all recognise that people want to take more charge of their care. They want to be in more control. So they're expecting healthcare organisations to be able to help them and provide that ability within their system. It's quite a surprising number already today of healthcare facilities using mobile apps and apps available, I guess wearable devices, etc. But that's increasing. We can see there's a prediction and a need for that to increase over the coming 5 years. With all of these things, digital transformation, there's challenges. And so our survey looked at what the challenges were as well. And I've just highlighted the 4 major concerns from the people that we surveyed. Change management was number 1. This was the biggest concern that came up in the survey. Change management. How it's not just about technology, it's about the organisations being committed and being able to follow that commitment through. Having a vision, being prepared to make changes, not just the computer changes or the digital, the technology changes, but being able to have their people adapt and willing to make those changes, and being committed and having champions. Interoperability, we see this as one of the key things in order to get that data, make it available, not only within the walls of the healthcare facility, but more now being able to push it out or make it accessible beyond the boundaries of that healthcare facility. So interoperability, the concerns were making sure that they purchased systems, got systems that were able to achieve the interoperability that's necessary to make these digital transformation successful. I was at and I'm sure a number of you here were at HIMSS this week. I attended the CXO meeting early in the week, and there they were talking about issues that are being faced in healthcare and generally around the region. And resourcing was one of their key topics. So resourcing in the sense of being able to find the qualified people, the people that are capable of being actually able to be part of this whole journey. And then how do you keep people? So you've got to be able to provide satisfaction in these systems, make the users happy, be very aware of being able to keep your staff once you've got them. And number 4 on the list was cyber security. We've all heard, and I'm sure many people in this room are aware of actual attacks that have occurred. And it's a very big concern. It's a big concern, I know, to all of your healthcare facilities, to be able to protect the privacy of patients, protect that data, and not expose it. I think this is in my mind, one of the key concerns that we have as an organisation of how do we help you when implementing these systems to protect this information. We recently caught up with Ken Mortensen, who's our Chief Protection Officer at InterSystems, and this was at our global summit just a week ago. Seems to have been a lot of activity in this last week. But we caught up with Ken, and he's going to have a talk about what we're doing in data cybersecurity.
I'm Ken Mortensen. I'm the Data Protection Officer at InterSystems. I come to InterSystems with about 25 years experience doing privacy and security. In fact, I like to say I did privacy before it was sexy. It was something that before I used to have to explain to people, but now people really understand that. So this is something I come with a depth of background, not only from a legal and a regulatory standpoint, but also from an engineering standpoint, having worked in the systems world for over 35 years. Cybersecurity is very important these days for healthcare organizations because of the value of health information. The information about patients is the most sought after information by cyber criminals. They get more for that information on the dark web than they would, say, for financial information, credit card information. Health information is what gets the greatest amount of money from an attack. This is the information that the cyber criminals are after, which is why healthcare organizations, hospitals, payers, insurance companies need to consider how are they protecting and safeguarding that information. Today, what we call advanced persistent threats, which are technological attacks on systems, are a huge problem for most healthcare organizations. But really, things like ransomware, where social engineering is used to be able to take a person to provide information to the hacker that then allows them to easily access that information. With interoperability being such an important factor in healthcare today, it's important that you need to consider where all the endpoints and where all that information is. For example, the cloud means that you now have an expanded view of not only where you can access that information, but where that information can be accessed from. That means that you have a greater surface area from an attack standpoint of where hackers can go after that. That said, the cloud also allows you to centralize the controls necessary to protect that information and to put safeguards for security around that information, meaning that you can actually take an advantage of the cloud in increasing the security of your systems. In order to protect yourself against these sort of attacks, not only do you need to have the right technology, but you also have to have the right culture. It's very important that you consider how are your people made aware of and what are they trained on when it comes to privacy and security. For example, here at InterSystems, we have within the Global Trust Program annual training that makes sure that every single employee understands what are their duties and responsibilities when handling personal information of our customers, of ourselves, and other confidential information to ensure that it's protected and safeguarded. The other thing you need to do beyond just improving the culture and having the right technological practices in place is you need to do a readiness assessment. And a readiness assessment allows you to be able to understand, do you have the right controls for the threats that you're going to experience? This assessment is pretty basic. It lets you look at training, it lets you look at penetration testing, lets you look at the types of attacks that might be coming through, and helps you understand better where you need to shore up your systems. What measures should you be putting in place to do that? And also, we're here to help. We understand how our technology works, so you should reach out to InterSystems, including me, if you have any questions about how to do a privacy and security readiness assessment.
So thank you. I think you'll get a good understanding from what Ken's just said. As an organisation, as a company producing software in the healthcare space, we're really committed to making sure that your patients' data, your information is protected and is safe. I don't very often get to make announcements, but just prior to starting today, I was asked to make this announcement, which was that both Forrester and Gartner reports will be out very soon, and I'm very pleased to say that Forrester has given InterSystems the highest rating for security. So in that report that'll come out, they've rated us as the company that is providing the highest rating in security. So I think that's worth a clap, don't you? Okay. Okay, as we heard from Terry earlier in the presentation this morning, I wanted to repeat something. Terry's words always resonate with me, and they resonate the truth of we as an organisation. InterSystems is really committed to the long-term partnership with all our customers and with all our partners. We have a passion for excellence, but more importantly, for your success. And I think those words have meant something to me for a long time. They mean a lot to our staff, and I hope they'll mean a lot to you going forward. We're fortunate that as a company we continue to grow, and that's the same here in Southeast Asia. We are growing. With growth sometimes comes issues and problems, but the company is investing in what's happening here in Southeast Asia. So I just wanted to spend just a couple of minutes explaining what's happening, what we're doing. We've been fortunate enough over the last 12, 18 months to win some new customer business. I think it was Luciano mentioned earlier on that we have customers that we've been associated with for nearly 20 years in this audience, and we've also got customers that are more recently signed up to put in track care, and we've just started their implementations. So we are fortunate. We have won the new business, and we are continuing to grow in that area. But we're also lucky enough that we continue to produce more functionality. We listen to what you tell us is needed in our systems, and we continue to grow the product and incorporate that in the products. So even with our existing customers, we're helping them grow. With all this comes more work and more things to do, and hopefully you will have seen us right across this region increasing the number of people that we're employing. It's not just about numbers, it's about the quality of people. And I hope you'll see more new faces, but I hope you're experiencing the level of people that we are employing and investing in this area. And finally, I think I've been in this business long enough to know that when you're implementing software, it doesn't go in without issues. It needs close partnership, closely working together. But we've also needed to improve some of our processes, like implementing quicker, more effectively, and less disruption to you, our customers. That applies also to our upgrade processing and being able to increase the functionality you have. We need to make our systems and processes better, and we really are listening to you, and we really are working on that, and hopefully you're seeing some changes already, but you'll see those processes getting better and better. Going back to our survey, the number one barrier I mentioned in our spot survey was to the digital transformation process is change management. And that certainly is true with all the EMR implementations we're doing. I know it's discussed a lot with ourselves, our customers and our partners, and that's really the reason today we've invited Class to present to you. Class is an independent health IT research company. They've done research globally surveying clinicians and what drives user satisfaction, doctor and clinician satisfaction in EMR systems. So I wanted to welcome to the stage Everton Santos and John Christensen from Class.
Thank you, Kerry. Thank you, appreciate it.